We've had 2 recently in the last week or so. We report those to the Department of Health. We follow all of the guidelines and work collaboratively with the Department of Health. We, of course, test and isolate and send people home for quarantine. We're very involved in all of the follow-up activities, doing the tracer methodologies to uncover anyone who has had close contact with these employees and testing all of them, making sure our patients and residents are tested and that they're safe. And what I would sort of add to it, the farther we've gone along into COVID-19, the less and less risk there is, especially in organizations like ours and the health center, of transmission. You know, everybody at this point, the supply chain has come up to speed to a degree. So everybody in Wahiawā General Hospital is wearing masks at all times. So transmission is, there's a lot lower risk of it. So as people are identified and sent home, so far we've had no cross contamination or transmission based on any of the positive we've had so far. So I stand for any questions you may have, Representative Brusa.
Amy, I think you're on mute.
I am muting myself. So thank you. And I will ask you a few additional questions,
Sure.
But that provided some useful clarification. So thank you. Ms. Harbin, we spoke on Thursday, I think it was, when you said you're asking the red team to come down and conduct testing. Is there anything you want to share about your decision-making or the situation that will help inform the community about what was going on
Sure.
on April 14th?
Sure. When this whole COVID process started to become obviously a growing concern, we went back as far as March 9th and became very involved with Lieutenant Governor Josh Green's weekly meetings. And we were also a part of the beginning of a task group for Central Oahu, made up of teachers, social services, the hospital, us, and the medical school and other doctors. So, you know, we immediately saw what the potential impact would be on our health center. And it became very dear and near to our hearts when 2 of our staff, one of which was on vacation, came back from a state that was really ramping up. So that employee stayed home on isolation without coming into the center. And within 5 days, that employee showed symptoms and immediately sought out care. Our second employee, the following week, came into contact with another family member coming from another country that was also highly infected, to the point where that person picked up her family member at the airport and lives with the family member. So again, that was a travel situation. So we immediately reported those to the Department of Health. And of course, then they started checking with the families, and they did find infections in the families, and the families all became quarantined. The last employee just this past week was definitely a community contact. It was not from the health center. It was from the home situation. We in Wahiawā all live in like 3 generational families. So if somebody starts coughing and getting sick, it just moves on to the next family member. And that's what happened there. So what we've done is we've been proactive since like at the beginning of March, where we closed our doors and only allowed patients in that had been checked and were not with fever or any symptoms. Our staff was checked once, sometimes twice a day. They even stopped me and checked me as I was walking in. So, you know, we've run a very tight ship. Our biggest problem has been the fact that we, as a new business, did not have a stockpile of masks and other protection equipment. So we had to be really careful about how we exposed our staff to any kind of potential contact. Now, you know, my job as CEO of a brand new health center that's struggling is first and foremost is to take care of our staff, to make sure that they are protected. Our second job is to protect protect and care for our patients, especially our vulnerables like our kupuna and the big population that we have of young babies and pediatric patients. So those have been very difficult to care for when we can't let them into the clinic for fear of any kind of contamination. So, and then finally, my big job is to protect the health center. It took us, 9 years to get this health center started for the community. And now we're suffering an 80% loss of income because of the fact that we immediately canceled all of our appointments. You know, you have Kapuna coming in for their Medicare appointments, children coming in for vaccinations. We canceled everything through April 30th. And so that no one would come in and get contaminated. And we're just now pretty much ramped up where we're going back to patients now and engaging them in telephonic services and where possible, telehealth, televideo. So, you know, those are the things that we are doing. Now, with regard to my hope to get the red team out there, the red team was something new that they could go to a potential site. I was trying every way possible to get help for the community and help for the health center. We were not allowed to have a lot of PPE, like I said. We were not allowed to have test equipment, you know, the testing equipment. And then finally we were given a limited amount, but we could only use it when somebody was symptomatic. And so we couldn't use them on our employees. We had to just send people out. So, you know, we were very hamstrung. I tried to get whoever this red team is to come out and help us at least get a baseline of what we have in our clinic. And that never happened. I tried to get help from Department of Health, from the mayor's office, but the issue is two avenues of thinking. One is you test everybody and find those clusters. The other is you save the equipment and just go where it spreads. And unfortunately, Wahiawā is being treated as a place to let it spread until it's time to come and try to determine how to manage. So that's what we've been doing since you and I first talked.
Okay. So that particular analysis and that particular issue about what's happening with our community, I want to come back to that. I want to circle back to that. But right now, I'd like to ask Dr. Jones, because you're serving as the COVID-19 point person for the health clinic, if you could talk to us about the role that you see the clinic playing in the pandemic, and then your particular responsibilities with respect to this new situation.
Well, we're not testing right now. We don't have the structure in place to do testing at our site.
Can you turn up your volume a little bit? Or
how about that?
Oh, that's good. Better.
I'll just hold it right in front of my mouth. We're not testing. So a lot of what we're doing right now for COVID for our patients is we're doing a lot of education and triage. So we have a lot of people calling us saying, I have symptoms, I'm scared, was I exposed? Is my family member at risk? So we're directing people to the hospital where appropriate, to testing centers where appropriate. We're telling them to stay home. We're giving them the instructions on how to be safe at home. So a lot of it is just education and triage at this point for us.
And quick follow-up for you, given that we have no testing sites in the vicinity, what are you recommending? So you're recommending that they go to that they just access the most available testing site?
So the majority of people who do call, we don't recommend get tested, not because we don't think they have COVID, but because they're not meeting the criteria right now for testing.
Right.
Just because you're symptomatic doesn't mean that you should be tested. It means that you should be keeping to yourself, but it doesn't necessarily mean testing. And then for a lot of people, what we'll do is if they meet requirements for testing, I will order the labs for them, send it to an HPH site. So usually Polymomy is the closest, and give them the instructions to go to the drive-in testing site at Polymomy. And then those results, the nice thing about that is the results come back to me. I do the follow-up, I do the reporting, I interface with the patient and the Department of Health. So as a PCP, I can make sure that everything's running smoothly. The other option is people can call the Queen's COVID line. They do the triage, they order the test,
Okay.
and they do some of the follow-up. It does sometimes get lost that way. So sometimes I don't get those results for our patients, but that's another avenue that patients can explore on their own.
Okay. So I want to, because we have such limited time to talk and there are so many issues to discuss, I want to jump in to the conversation around, well, the community conversation really. So on various Facebook group pages, we had some questions, and I grouped them into basically 3 buckets. So the first is health questions. The second is kind of questions about the sequence of recent events and their consequences. And then the third bucket is community support questions. So what role do you know, the hospital and the clinic play in terms of supporting the community? And so I think the first 2 questions are really for you, Dr. Jones. And the first question, both of these are from Banner Fernandez, who's a very active community member. And he asked first, is drinking hot drinks like lemon or lime teas a way to kill the COVID-19 virus if one is infected?
Is my microphone better now, or do I still
It
need
is
to?
better. You are
Oh, it's
better.
better. Oh, I fixed it. Okay. So hydration is always key, especially if you do have COVID. If you have a fever, you're going to dehydrate faster. If you're breathing heavily, you're going to dehydrate faster. So hydration is key just in terms of controlling your symptoms. But in terms of drinking hot beverages, those haven't been shown to kill the virus. I know there were some people who were taking really hot baths, and the CDC was saying, please don't do that. There's a risk for burns. It doesn't help. And then whether citrus fruits kill the virus, there's been no evidence of that either. So hydration certainly, but not necessarily a hot drink or lemon or lime. But if that means you drink more water because it's more delicious, then please just go for it.
Thank you. And the second question, is it true that staying in bed to rest to fight COVID-19 is not good, that it's better to be upright to force yourself to cough and clear your lungs?
So there's something called pulmonary toilet, where you try to keep your lungs as open as possible to kind of keep them clear and keep your breathing better. But it looks different for different people. As long as you're breathing, I would say you're doing a good job. So if you're really, because fatigue is a big symptom. So if you're not able to get out of bed, don't feel guilty for that. As long as you're breathing, and as long as, you know, you're lying there and you feel like you're still safe, go for it. If you're having enough trouble breathing that your posture is starting to affect your breathing, that's when you should call your PCP and get more specific instructions and see if you might have to go to the hospital for assessment.
Okay. Thank you. Now we're going to jump into the questions around the sequence of recent events. So, and this I think is for Ms. Harbin. Kathy Cruz asked, why did it take so long for the news to report about medical arts in Wahiawā? I found out like a week before the news said anything, and were all of the patients that went to the health clinic, were they notified?
Yes. You know, putting out information via media isn't always the correct immediate response. We did what we could to get information posted on our website. I believe we posted a letter on the website. We've kept our staff completely informed. Once we had knowledge of a positive, even with the 2 that were completely travel related, I did inform the board of the Wahiawā Medical Building of the fact that we did have positive COVID, but that they were all quarantined. So just to give them a heads up so that all the businesses in the building knew that this had happened. So, you know, we did our best, and we then sent out a text to our patients to let them know that we were still here, we were still open in spite of, you know, having some positive tests. So I don't think, you know, the job is to get to the media and let them know what you're doing. The media will come to you if it's an event. And what started the media considering this to be an event was the simultaneous occurrence between Wahiawā General and Wahiawā Health Center. And I think what further engaged the media is that once we had the knowledge of a community infection of someone that had come into the clinic, I immediately took steps, although I knew it would be financially very disfavorable to our clinic, and we closed the clinic down. We immediately sent all of our employees to get tested. And we're still in shutdown, physically shut down. But what we did was we had already been transitioning to telemedicine. So starting in late February, early March, we were already engaging patients via telemedicine, so that in early March, when we canceled all well visits for everyone until after April 30th, we were already engaging them in telemedicine. So, like I say, with an event like this, it's difficult to get to the public at large until you connect with press. And I was already ready for them. We had a question and answer ready for the press. So that's why the information came out very clear, because we had prepared for their calls.
Okay, thank you. That was helpful. This seems like a related question, and you may or may not be able to answer it. It may be too soon to answer this. But Darlene Natividad asks, if the nurses got the coronavirus, did any patients get it?
No, not that we know of. We have been in the clinic for the last 3 weeks, keeping our staff away from each other. We've got them in different rooms. We've got them setting apart. We now have adequate PPE where they are actually everybody's covered. Everybody's got on a mask. You can't come in the clinic without a temperature test and a mask. And you're not allowed to sit next to each other. Everybody is not allowed to go into the lunchroom, which is a fun time for everybody together. Everybody eats separate. So, we've taken all of these steps that the Department of Health and the CDC has been requiring since the very beginning of all of this whole crisis. As far as patients getting it, I don't believe any patients came into contact with any of our MAs because, like I said, we had already closed the doors 3 weeks ahead of time, and we were not bringing patients in the clinic. We were dealing with them by televideo or telehealth. So, we took every precaution possible early on.
Yeah, that's good information. The next question I have, I don't know if you can answer it. There was a doctor who, and I think this is for Mr. Cunningham, who supposedly contracted COVID-19, and a person in the community is asking about the doctor's current condition. And I don't know if you can share anything about that, but just to let you know that concern is there.
Yeah, that would not that I know of, not a doctor in Wahiawā General Hospital.
Oh, really? Okay. So that actually is a pretty live rumor.
Well, let's help with that rumor. Dr. Jones, do you have anything to add to that?
You're muted.
Okay, you want me to, I can answer
Why
this?
don't you give an opening statement, Beth?
Yeah. First of all, we are controlled by HIPAA, the privacy law. We can go to jail real fast by disclosing who or what someone is. We also have an HR issue where we can't be running around talking about our staff or even our patients. I will say, and I've said this earlier, we have two staff that have contacted the COVID virus from other areas. One was on vacation and one was picking up somebody coming back from vacation. And that is pretty much all we can say. This is a very small town, and, if anybody at a later date would like to disclose their experiences with the COVID virus, then I'm all about calling another one of these Facebook things and sharing the experiences with you. But right now, we can't address that.
And Dr. Jones, did you have anything to add to that, or?
Oh, I was just gonna. Nope, that was good.
Okay. Okay. Another question in the same area. how or did Wahiawā Health Center or the hospital monitor or follow up on workers who are quarantined, especially workers who may have been exposed or tested positive, who may have other jobs? And does the follow-up include asking about how family members are doing with the quarantine situation? So maybe you can just talk about the process you use to kind of communicate with your workers who have been quarantined and monitoring, I guess monitoring, that's what the concern is for the community.
I can, if I could speak to that.
Yeah. And then also Mr. Cunningham too, after.
Yeah, let me tell you my philosophy of being involved in a small business. We're a nonprofit, but we're a small business. I've been a small business advocate my entire life. And my philosophy of being involved with a small business is that every one of your employees and their family are your ohana. Every one of our staff who has gotten ill, or in fact, another staff who was quarantined because her dad got ill, I follow up with those people every day. I follow up to see, how are you doing? How are your family doing? I either call them or I send a text message, so I know what they're doing. Now, with regard to the question of someone who is working for us, who becomes quarantined, but they have a part-time job, well, I'd sure, the way we work people at Wahiawā Health, we're so dedicated that I'd sure hate to think that they have a second job. But if they do, my comment there is, each one of us have a responsibility to our community, to our organization, and to ourselves to keep ourselves safe and quarantined and be with a mask so that we don't add to the pandemic. So all I can hope for is that our employees have been shared so much information that they take this to heart. And if they do have a part-time job, that they are also on quarantine leave with that job.
Thank you. And I think that actually the CARES Act provides for, and other federal legislation provides for leave.
Yes.
So I would be surprised if they felt like they had to go to their second job, because that income would be replaced under that legislation.
Yes, and we are, all these folks that are out, in fact, when we closed the center last week to just do a biohazard cleaning and kind of regroup this, what I call a transition. This is like an immediate transition of how we do business, how we deliver healthcare. It's never going to be the same again. And we're implementing those changes at every day. So when we closed and everyone that was working at the time, they're all on full salary. We need to keep them whole. We've tried to help all of our employees through this transition, and those that were laid off because we had absolutely no income coming in starting from the beginning of March. We've worked with them to get them on unemployment as soon as possible. Yeah. And we've kept their insurance alive so that they have health insurance. So we're doing everything we can do within our resources that are quickly diminishing. And yes, the CARES Act will be a big help for us.
Okay, and I do want to come back to these fiscal challenges in a little bit. Going back to the immediate consequences of the event, another community member, Sheila, asked about, what about the rest of the medical arts clinic building? And I think you spoke to that you spoke to all the owners of the other spaces, but the question she raised is if there's any risk of contracting the virus through air conditioning ducts.
I have spoken with our architect, and there is, because there's filters, there is no possibility of that. And our whole, when we remodeled 2 years ago, we have a completely new air conditioning system, and we service it on a regular basis. So I cannot anticipate, nor have I heard anything of this being transmitted through air conditioning. I mean, I'll stand corrected if there's some new research out there. And then while I have the the microphone, I really want to clear up the name of the building and the name of Wahiawā Health. The building at 302 California Avenue is called the Wahiawā Medical Building, and it has been since the 1970s. The biggest organization that was in there for 30 years was a personally owned clinic called the Medical Arts Clinic. The Medical Arts Clinic is who we purchased that practice. Dr. Manuel Abundo retired, and we purchased the assets of the practice, and we purchased the office space. So for clarity, 302 California Avenue is the Wahiawā Medical Building. Suite 106 is Wahiawā Health.
Yes, I absolutely get that. I think that these names stick for a while, so don't take it personally if people hang on to those identifications. But I think that it's just a way to signal what building they're talking about, so everybody understands. The next question actually is for Dr. Jones, and I don't know if I put this in the right bucket, but. Banner Fanene asks, realistically, when do you think Wahiawā can expect to defeat COVID-19? And will this be on the same timeline as the county and state? So maybe you can speak a little bit, elaborate a little bit more on this idea of community spread and potentially untested, unidentified community spread.
So defeat is a hard word. Can you hear me?
Yeah, I can hear you, but not very well.
I'll just hold it up again. So defeat is a hard word. We haven't ever defeated the influenza virus, and there's the potential that we won't ever, defeat the coronavirus that we're dealing with here. We will hopefully find measures and, vaccines, things like that, universal testing to try to combat it. So in terms of defeating it, but in terms of when we can consider ourselves to go back to something resembling normal life, that's going to depend on a lot of factors. It's going to depend on how well we do the social distancing now. It's going to depend on how and when it's lifted. So there's a lot of factors that go into play, and there's a lot of modeling being done. And I think everyone's saying, they're just models. So in terms of giving a timeline, I mean, if you look at a lot of the models, they peak around June, try to come down around July, August, kind of still hover, they're not flat. So that's kind of a model there. In terms of Wahiawā compared to the county, compared to the state, that's really hard to say because we don't really know what the numbers are in Wahiawā. We don't have a testing site here. And by that, I mean, we have sites that test, like Wahiawā General ER, if it is deemed necessary, they'll test, but we don't have a designated, say, drive-in testing site where people just get tested and then go home. So we don't have in our community an easy access way for a lot of people to get tested. So we just don't have the numbers for Wahiawā. So there's nothing really for us to extrapolate right now. And just given the fact that we've been in the news recently, I guess, that's a good sign that we probably have this in our community. And by probably, I mean we do. And that we are spreading it to each other because we do live on top of each other, as Bev said earlier. So we need to practice caution in Wahiawā. We need to do everything we can to try to keep ourselves from spreading it to each other. But in terms of a good sense of our numbers and our peak and how we're going to flow along with the rest of the state, it's really hard for us to say here.
Okay, thank you. I think that's fair. So I'm going to move into the third bucket, which is community support questions. Natalie Napoleon asks, with this pandemic going on, why do I see more and more out-of-state homeless in Wahiawā? Are there any clinics nearby or anyone trying to get those people tested and screened? And I know, so either Mr. Cunningham or Ms. Harbin, if you could speak to that.
Bev, would you like to speak to that when you were talking earlier about sort of your role in homeless? Obviously, if people need their emergency department services, homeless will come to us. So we do see some of our homeless population through there, but I think the health center has a much larger role. So to Bev.
Can I ask, before we move to Bev, can I ask you, Mr. Cunningham, are you seeing more and more out-of-state homeless coming through your ER?
You know what? I don't think we identify them as that. I can look into that data, but I don't know that we identify in-state versus out-of-state.
Okay.
So in answer to your question, we are designated as a federally qualified health center for primary care. But because we have such a large homeless population out here with our narrative to the federal government, when we applied, they gave us the opportunity and they designated us as a homeless care site to deliver primary care to the homeless. So we're required to care for homeless. We work very closely with Nikki, I forget her last name, but she's the CEO at Alea Bridge. We work very close with them. Their social workers will dig people out of their encampments, and if there's infections or problems, they will come to us for routine primary care. We have gotten a grant to help care for homeless, where we've got a bunch of iPads coming, where we can take them to the patients for telemedicine. So, but the issue that we're concerned with right now is there's been like a 3 times growth in the encampments of people coming in from downtown Honolulu into the Wahiawā camps. So we have a huge growing population of homeless in Wahiawā. And what that begs the question of is there's got to be some rampant COVID going on in there. But again, it goes back to the city and county of Honolulu and the governor and Department of Health have got to step up and come out and help our community with testing, because we really feel that there's pockets of contamination going on. And if we don't get people out of those pockets and get them well, it's going to be so bad out here. And I have been in long talks with the mayor's office and Department of Health and Josh Green's office. But again, because the Department of Health is being so tight on the test kits, they're not coming out to us. We even offered to be a test site before we started seeing COVID in our staff. We offered to be a test site because we have a large parking lot where you can make a big circle and get people taken care of, but they would not give us the supplies. So, this is a political problem that somebody needs to carry the message. And I think our members of our community need to know that Wahiawā General Hospital and Wahiawā Health Center, we're struggling to try to make ways to get our community checked, to get us evaluated. But unless Honolulu people start taking a look at what's going on out here, we're going to be the last to get served. And our homeless population continues to grow.
That's an important message, and I take that seriously, and I will think about how I can advocate more on that front. I want to move to the next question. Jill Sprott asked, how frequently, and this is for both Mr. Cunningham and Ms. Harbin, how frequently are healthcare workers in our area being tested? Is there routine testing being done of any of these workers, even if no symptoms are present and no contact history is revealed? And if not, what measures can be taken to ramp up testing, which kind of speaks to your last statement?
So I would say, are healthcare workers being routinely tested? No, not at this time. And for many of the reasons that Bev mentioned earlier. Now, more and more tests are becoming available. So that will be a possibility, I believe, in the future. But tests, and as Dr. Jones said earlier, tests have been limited to people with symptoms, sometimes needing to be significant symptoms. So, at Wahiawā General, we've been saving the tests for people that come to our ED or those with symptoms. We are, since we've had a couple cases recently, we are starting to test as a precautionary measure, systematically going through all of our WNRC, our Wahiawā Nursing and Rehabilitation Center employees, to test them out systematically to make sure they're not bringing something in that may expose our residents. But beyond that, we're still waiting for availability of more testing so that we can expand those efforts.
And is the situation pretty much the same for you, Ms. Harbin? That now you're closed, right? But you weren't testing your workers prior to this because the criteria for testing were so high, right?
Yes.
Okay.
Yes, I'll speak to that. The criteria was very high, so we were really monitoring our staff on a daily basis for anybody with symptoms. And if they did get symptoms, they were out of there. They were off to get their tests, and then they were sent home with pay until we got the results of the tests. So that has been our practice all along. The one good thing that I can say, thank you to the media. Everybody's afraid of the media, but I have to say thank you to them, because what they did was they brought our plight, I think, to the state and city officials. And I think they brought our plight to our fellow community members, that perhaps, now we can get some help. And when we made the call to DOH and we made the request that every one of our staff will be tested, symptoms or not, they agreed to it. So we put them in a car and we sent everybody down to Polymomi. So, it's unfortunate that it has to take an event and a media blitz to be able to get help, but we did get help that way. So, and, maybe now we'll have more consistent ability to keep our community safe, but keep our staff safe. Because if they start falling off, which is what's happening on some of the states on the mainland, then the community is not going to have anyone to go to. And when I talk with Department of Health and I talk with the mayor's office, here's a big problem. We can have patients that are symptomatic. We don't have a testing site here. Many of our people in all of our surveys since 2011 have said, what is the barrier to care for you? What will, what can we do to help you to gain care? The number one issue is transportation. Because if you have to go to Polymomi for a doctor's appointment or a specialist appointment, many of our people have to get on the bus. So I told the mayor's office, all right, if you can't come out here and do testing, how about I start sending people on the bus that are suspect? And they said, absolutely not. I said, so we hire cabs to transport patients to Polymomi if they need specialists. The cab companies will not take our patients anymore. They do not want patients in their cars. So we in Wahiawā have no way to get to the testing site unless we can get on buses, which is the majority of way people get to town. So, it's a bad situation out here. We're not the outer islands, but we are ignored. And, it's going to be bad if we don't get help.
Yeah, I can see how that, all of those factors can kind of come together and create like a disaster here. So that was the end of our community questions. And I had some questions about moving forward. I know that we're still in the midst of, we're in the grip of this crisis, but it's my understanding that the federal legislation under the CARES Act does offer some hope. And I was wondering if, Mr. Cunningham, if you can speak to that, if there is a possibility of support for the hospital under the CARES Act, and how, and then also I think the final question actually, it kind of connects to what I wanted to ask, which is why I transitioned this way. But the last community member asked for you, Mr. Cunningham, he's praying that Wahiawā General Hospital does not permanently close. He says, other than patronage, what can I do to assist the hospital in remaining open for decades to come? And so that's why I kind of was thinking about the federal legislation, but maybe you have other ideas too.
Thanks so much. I'd like to thank many of the organizations, community organizations, individuals that have donated to us during this time. That's really helping us move forward. We have applied for all of the elements of the CARES Act. So there is some advanced Medicare payments that we're receiving some funds for, the PPP, the payroll protection program, and we should be receiving some funds from that. And that's going to help us get along for the next couple months. Bev was talking about it earlier. That's going to help us for the next couple months. But like the health center, our volumes are down, our emergency department, all of our outpatient services, inpatient, are down between 50 and 75%. And that is obviously not sustainable for Wahiawā General Hospital, to the second part of that question. So we are getting in line for some funding. It's going to help us through the next couple months. But what we need to continue to move forward, and what this person can do to help, is, as you know, the safeguards are lifted and people can move around a little bit more, we're hoping that people come back. We're doing everything we can at Wahiawā General to be safe. We have a safe environment. We screen all employees for symptoms, and we do temp checks daily. We are wearing our PPE so that there's very little risk of any cross-contamination. So we're creating a safe environment. So when it's time for people to come back out of their homes again, we're there for you. And we look to get services back and be serving the communities as we have for the past 75 years.
Thank you. And just to clarify, so the monies that are going from the CARES Act to the governor, that is what you're talking about in terms of the advanced Medicare payments, right?
Yes.
So are there any additional funds that are also included in the federal legislation or not? Because I'm not sure about that. They haven't sent out the guidance on.
Yes, there were some funds from HHS that came through the governor that we had received about a week ago. You know, relatively small amount that helped us a little bit, a couple $100,000 that helped us a little bit. The Medicare advance payment is sort of a loan from Medicare. It gives us money ahead of time. That will help us for a couple months, but we have to pay that back starting in the next couple months. It's the PPP, the payroll protection, that will really help us keep our workforce in place, even though our volumes are down. That's really going to help us. But that'll only last for 2 months once we receive it. So unless there's something behind that, we're going to be in a serious challenge in about 2 months. Hopefully there's something behind that. I know federal government's talking about it, but the real sustainability for us is, as things are lifted, as people can move around again, that people know that it's safe to come to Wahiawā General right now. We are open for outpatient services right now for those in need, for those in emergent or urgent need. We are fully open. It's just that we're being safe, and I know people are staying home and being as safe as possible. We are open and ready for business, and when things are lifted, we're looking forward to people coming back and serving their needs.
Thank you. I appreciate that. And I realize, like, for the community, like, this is maybe a little bit too wonky or too detailed, but I think there are some folks who really appreciate understanding funding and fiscal viability, and because then we can better support the hospital and the health center. So Ms. Harbin, can you also speak to that, the fiscal challenges, and if the federal legislation is going to be helpful?
Yeah, I ditto what Brian said. We're in a little bit of a different position. You know, we're a federally qualified health center. We do everything that the Waianae comps of the world, and Waimanalo and Ko'olauloa and Kalihi Kokua Valley, we do exactly what they do. We as a federally qualified health center. Unfortunately, we're what they call a lookalike. So although we have to do everything that they do, we do not get any funding. They get, you know, operational money from the federal government every year. We do not. The federal government dropped $10 million into the state of Hawaii about 3 weeks ago for the health centers, and it was divvied up between all the health centers in the state except us. So, you know, we're surviving on what we can borrow. We're surviving on, it looks like we got the PPP. Again, like Brian, it'll be sufficient to keep our staff cared for another 2 months. But when you lose 80% of your income, and, you know, we're paid like maybe a month and a half after the fact. So when the engine stops, you're going to feel that loss of income for months thereafter. You know, the help, we're just trying to figure out how can we hold this together, because one, the staff and their families depend on us for their survival. You know, since we've opened, we're up to 38 employees, so we're an economic engine in Wahiawā. But if the engine doesn't have any gas, we're going to have to downsize incredibly down and hope that we'll be able to ramp up sometime in summer.
So both of you mentioned 2 months, and I'm wondering for your purposes, for the purposes of PPP, when did that 2 months start? Just so I can be calculating how much time we have.
For the hospital, it has not started yet because we've not received the payment. So,
Okay.
you know, we did get in line for that first wave. We have received preliminary approval. So it's one of those any day now. So once you receive, the clock starts from there.
Okay.
And I'll let you know. I'll reach out and let you know when we do receive.
Okay. Ms. Harbin, has your clock started?
No, because we're living on our reserves right now. Our business started turning the corner the last half of last year. And the first 2 months of this year were our best years, where we like improved about 60%, because we're more efficient and more people are finding us. So we grew substantially in January and February. And then the bottom just got cut out in March. So we had built up enough of a reserve where right now I think we can get through about another month and a half. If we can get that PPP, that will help us then take us into another 2 months.
And have you also gotten preliminary confirmation?
Yes, we did. We did.
Okay.
We did get a confirmation that we've been approved, and we made the first wave. So it's just a matter of the bank getting the paperwork done and figuring out how much we get. So.
Okay. I have a question for Dr. Jones, since I have her here. So I'm curious about practicing medicine in this context, in the clinic. What do you experience any frustrations, or how is it for you? Because my experience with medical professionals has usually been in person, and there's usually like, you know, the face-to-face kind of conversation. And as you guys move towards telehealth, and I know that's a institutional structural shift that you're doing anyway, but in the context of COVID-19, are there any additional challenges?
You mean specific to telehealth?
Doing telehealth in this kind of environment where, for me anyway, doing my work feels harder because I don't have contact with people. So and I feel like not everybody is connected through social media or the news, or, you know, I feel like there's a lot of disconnection. So I feel like it's more challenging for me to do my work. And I don't know if you feel that doing the work that you do, because you're also connected, like your relationships are with the community, they're direct relationships, you know?
Right. Yeah. I mean, a lot of what we get is people stumbling on our door and saying, oh, and then walking in. So with telehealth, that takes away a lot with our interface with the community. So, you know, we're still doing telehealth. We're still examining patients to the best that we can over the phone, or even now, you know, I can look at you and say, okay, she's not breathing fast. She looks like she's probably okay. But there's a lot of depersonalization that happens through this, and there's a lot of like you said, disconnect, because, you know, you just aren't able to capture as many people, and then, you know, when you're on the phone, a lot of it for us is getting over the technical issues from our end and from the patient's end. So it's frustrating for everybody, and not everybody has access to the materials they need for telehealth as well.
Yeah.
So it's just it's a lot.
Yeah, I think those technical things, I think that you guys are going to be able to transition successfully. So my sense of working with the community right now is that there are such high levels of anxiety and stress, and I honestly feel like it's a collective trauma, you know, and we aren't experiencing the worst of this, but I feel like as a larger community, it's painful. And it must make doing medicine hard.
Yeah. I mean, there's all these articles out, right, about how anxiety levels are higher, people aren't able to function as well, and that really contributes to health declines. And if you are already, you know, have an illness that you need to manage carefully with medications, it's going to be harder to do that. It's just everything feels harder for everybody, even people who are healthy right now. And, you know, it's harder for the staff too. So there's a lot of, it kind of just feels like before I was just doing healthcare, and now it feels like I'm trying to do it swimming through pudding or something, you know, just everything feels a little bit slower and a little bit harder and a little bit heavier.
Yeah, I appreciate that sharing that.
And if I could just add to that, what I'm seeing is with so many private physicians shutting down their doors, for them to be able to ramp up is going to be terrible. We have so many people calling us that says, my doctor's office is closed. I don't know when they're going to open. Can we come in and see you? And trying to triage those people and determine how can we help them, because, you know, they've got medical records elsewhere. And the thing that's been really bothering me the most is our pediatric care. Our pediatric staff, it's terrible when Capiolani calls and says, look, we've got this newborn and we've got to get the newborn in, and we've got to figure out a whole separate day process, cleaning process, workflow to bring a brand new baby in. We have babies that are very young, that are premature, that have had major surgery. We've been doing telehealth with them, but there comes a time when the provider has got to have hands-on and making sure everybody is totally PP'd up and there's nobody in the clinic, it's sanitized, and then take that child and you know, it's just so sad for these populations that can't really speak what's going on, and you've got to have the parents take their temperature and press here and do here. It's going to be a heavy process where some of these specialties it's going to be a little bit harder.
Okay. I appreciate that you are so honest about the challenges.
I have more. You want me to share more? I can share more.
I think I'm okay. But I did want to, our time is kind of coming to a close.
Sure.
It's been just about an hour, and I wanted to really thank you from the bottom of my heart for joining us today. I know the community was concerned, and I think that it's nice that you're both reassuring us and lighting a fire. So,
yeah.
I appreciate that. I think that's hard to do. But if you have any other things that you wanted to add before we sign off.
No, I want to thank you, Representative. It's so hard sometimes to get positive stuff out there when you're so surrounded by all this fear and anxiety. But, you know, I will tell my passing comment is let's turn this to a blessing in disguise, because I think access to healthcare is going to change radically. And I think if we find the best way to mix the old with the new, we're going to be able to take care of way more people and keep more people healthy when we get out of this.
I hope so. Mr. Cunningham?
I agree with Bev 100%. That's well said. And I would just like to thank you again, Representative, and thank everybody in our community for hanging in there. And our hearts go out to you, and we're here for you.
Yeah, thank you. Dr. Jones?
Yeah, thank you for this opportunity. And for anybody listening, I think one of the big things is anxiety and questions and not having answers. So, you know, you can always call, and questions and answers are what the phone is for. So that's what we're here for.
Great. Thank you so much. And hopefully we'll do this sometime soon.
Oh, absolutely. Thank you so much.
Thank you.
Bye, everybody.
Bye.
Bye-bye.